Hello, I'm Isadora Patterson and I'll be talking about thalassemia. Thalassemia is a subgroup of diseases caused by mutations in the globin genes that lead to impaired globin synthesis transmitted in an autosomal recessive form, meaning that an affected individual needs two copies to completely show the phenotype. It is an inherited parents pass to children blood disorder characterized by less hemoglobin and fewer red blood cells than normal. Signs and symptoms may include fatigue, weakness, pale or yellowish skin, facial bone deformities, slow growth, abdominal swelling, and dark urine. The type of thalassemia depends on the number of gene mutations inherited from the parents, in which part of the hemoglobin molecule is affected by the mutations. There are basically two major and genetically different types, alpha and beta. Alpha thalassemia comprehends two clinically significant forms, the HB-Bart syndrome and the HBB disease. The syndrome is caused by deletion of 4 alpha globin genes, and the disease is most frequently caused by deletion of 3 alpha globin genes. The beta thalassemias are slightly more complex genetically. If the patient is affected by the syndrome, also the more severe form, it will show at early age, and death usually occurs in the neonatal period. If affected by the disease, patients get anemia, spleen enlargement, yellowish mucosa, and sometimes bone changes. And now, regarding the beta thalassemia, 3 conditions of increasing severity are recognized: the carrier state, the intermediate thalassemia, and the thalassemia major. The carrier state usually has no symptoms and is defined by specific hematological features. Intermediate ranges in severity from the asymptomatic carrier stage to the severe transfusion needed type. And thalassemia major is the most severe form. Individuals usually come to medical attention within the first 2 years and require regular blood transfusions to survive. The case study that I did is vertebra plana due to thalassemia. Vertebra plana it's kind of osteoporosis in a 17 years old patient with normal vitamin D, calcium, and parathormone levels. And he had transfusions and chelator therapy on regular basis. And also he had surgery with good prognosis. And osteoporosis happens 40 to 50% of people in thalassemia major cases. The etiology and pathogenesis of the disease, it's alpha or beta globin. The major is homozygous, the minor is heterozygous. And the alpha happens in Southeast Asia, the Middle East, China, and in Africa descendants. And the beta, it's from Mediterranean origin, and less people from China and Asians and African Americans are also affected. And there are hypotheses of being protective against malaria. The phenotype and natural history is that genetic testing and screening is highly recommended, as well as laboratory diagnosis for specific traits differ from other types of anemia. We need to do the management of the thalassemia major cases, transfusions and chelation, and also the management of side effects or complications of the conditions, remembering there are no major issues if well managed. Continuing about the management, the heterozygous need no management since they are asymptomatic. In the homozygous, the intermediate cases only needs management when the symptoms are present, and the major needs blood transfusions folate and chelation, and also the management of complications and side effects of treatments. The prognosis is fair. It can happen early death among 20 to 30 years old due to heart failure, and also complications like delayed growth, lung or heart problems, cancer, and others. The factors or risk of thalassemia varies depending on the type of thalassemia and the specific genes affected. The genetic screening is the best option to evaluate the risk, since it's passed from parents to children. If there is family history of thalassemia, you better get tested. And since also there's like the ancestry occurs most often in African Americans and in people of Mediterranean and Southeast Asian, ethnic group is also a risk. Those are my reference. Thank you. Good night.